friends, I am Dr. Shruti Gupta, Consultant Gynecologist at Bliss Hospital in MDC Panchkula. And in the phase that COVID has entered now, we are getting to see increasing number of cases every day. And if we are pregnant through this era, we need to strike a balance between risking ourselves to infection by visiting hospitals and ultrasound centers and keeping our pregnancy safe by keeping it monitored. So it helps to be a little aware about the medical condition ourselves so that we can pick up the danger signs and restrict the routine visits to essential ones. In fact, there are guidelines which are issued by AIIMS to this effect, and I want to share the same with you for your benefit. The first thing to decide is when to undertake the first visit after you detect your pregnancy. So whenever a period is missed or the period becomes unexpected, the first thing you should do is to do a home urine pregnancy test with any kit available at the chemist. And if it comes positive, we need to know if our pregnancy falls under a high-risk pregnancy category. For this, we need to see if our age is more than 35 years or if we had any problem in getting pregnant, that is history of infertility. If we had previous pregnancy failures or previous high-risk pregnancies, or if you undergo any spotting or bleeding or pain during pregnancy. So if any of these factors is there, you need to visit your gynecologist immediately as soon as you detect your pregnancy. If none of these is there, the guidelines say that we can undertake our first visit at 12 weeks. This falls to be about 7 to 10 days short of completing 3 months from the last menstrual period. At this visit, we can utilize to undertake the first ultrasound, which is called the NT scan, which tells us about the well-being of the baby, as well as all the routine antenatal tests, blood and urine tests, to see that you are fit to continue the pregnancy and we don't need to change anything. Having done this visit, and we need a tetanus shot at this time, which can again be completed at the same visit. So if all is well, the next visit, the guidelines say, can be scheduled at about 19 weeks. This in months would mean about 20 days post completion of 4 months, that is in the 5th month, in the second half of the 5th month. Here we need to do a very important scan, which is called the Anomaly scan. We need to see if all the structures of the baby are well formed, and we take this opportunity to check the blood pressure, weight gain once again, and do a clinical examination. So again, if everything is going well, the next 1.5 months are probably the best and the least risk months, and we can pass them safely at home. The next visit we can take at about 24 weeks. This 24 or 26 weeks, which means at about 6 months completion. At this visit, we need to screen you for sugar tolerance with a glucose tolerance test. Again, check your hemoglobin, a urine test, and check the blood pressure, weight gain, and growth of the baby just clinically. If everything is going well, the next essential visit comes at 32 weeks, which is at 7.5 months. And subsequent visits can be decided according to how your pregnancy is going, how our baby and you are faring. And if we are taking this risk of reducing the antenatal visits from monthly or every 15 days to every 1.5 months, we also need to know how we monitor our pregnancy at home. So for that, we need to keep a check on our weight gain. In the first 3 months, we may not gain any weight. In the next 3 months, about a kg per month is good enough. And subsequently, we need to gain about half a kg to 600 grams per week. And when we have completed our 6 months, we need to keep a check on the daily fetal kick count. And if we can, it will be good if we can check our blood pressure at home at least every 4 weeks, if not sooner. In between, if you feel there is a doubt about whether you really need to visit the doctor or not, you can use the facility of teleconferencing or teleconsultation. And at every visit that you need to undertake, it will be good if you can take a prior appointment so as to avoid the waiting time. So I'm sure that we can undergo our pregnancy absolutely safely and have a good outcome for both the baby and the mother, even through these uncertain times. And if you have any more queries, please visit Bliss Hospital in MDC Panchkula, or you can contact me at my number.